As COVID cases surge across India and help from all over the world is pouring in India, we at NewsMobile want our viewers to stay safe and stay informed on the COVID-19 pandemic. And joining us right now is Dr. Mufazzal Lakrawala, Director of Surgery at HN Reliance Foundation Hospital and one of Mumbai's very well-known surgeons, and he's also a COVID warrior. Thank you so much for joining us here on NewsMobile, Dr. Lakrawala.
Thank you, Shivangi, and I hope that everyone is safe, not only at home, but everybody around you is all safe.
Yes, Doctor. Dr. Lakrawala, right now, Mumbai accounts for almost 20% of COVID-19 cases in India. So when the pandemic had first broken last year, you had volunteered with the BMC to set up quarantine centers. It's been almost 1 year now, and we are still seeing huge spikes in cases from Maharashtra. What is your analysis of the situation?
I believe that this pandemic has engulfed the world like it's engulfed Mumbai. Mumbai being one of the cities where there's a maximum number of foreign people coming in, it was bound to be one of the cities that was going to be worst hit. Another thing is that it's the most populous city. The number of people living in the massive slums of Mumbai, it's almost impossible to maintain social distancing. But the only difference, if you were to ask me, when I jumped into this fight was to take away stigma and to protect my healthcare workers. I think I've managed to do one thing. I've taken away the stigma from this disease in the sense that today, when people get this disease, they're not so scared of getting the disease. They do know that there's a recovery rate of around 94%. Way back in March or April last year, that was not the case. The other thing is that how else it has changed. Well, today there are more and more people, younger people getting infected because the lockdowns have ended. And because the lockdowns have ended, there are more and more people going to work, and that is why they're getting infected. There are a lot of young kids who are getting infected because they belong to the population group of between 18 to 45, and that is the working population group. So it's a sad outcome. We thought that maybe we are protected away from all these various options, but however, our genetics has not protected us. The Mumbai heat has not protected us. So one thing we do know that COVID is a killer and we need to be careful. We need to mask up, we need to socially distance ourselves, and we need to vaccinate as soon as possible because only then we'll be able to protect ourselves.
Right. Absolutely. Maharashtra also has a pretty high positivity rate. In fact, it's one of the highest positivity rates in the country. In press briefings, top doctors keep saying that as a nation, collectively, we should come together and make sure that the positivity rate drops down to approximately 5%. And 1% is ideal, but they are insisting that first let's focus on dropping the positivity rate to 5%. What is the reason behind Maharashtra's high positivity rate and how can we tackle it according to you?
I think Maharashtra has been one of the states which has always been very, very outcoming with their number of tests that they've conducted. They conduct a huge number of RT-PCR tests as compared to the rapid antigen tests, and therefore you have a very high positivity rate. Again, being one of the most populous states, that is bound to affect. And the important fact is that they've been very, very clear with the data as far as the chief minister goes. We've heard of news reports saying that some data has not been as honest as what they should have been. I think Maharashtra has been one of the states which has been very, very honest with this data as well.
Okay. All right. Dr. V.K. Paul, who is the member of the government's health task force, said that wearing masks at home can save lives. Now, this was something which made headlines that wear masks at home as well. So this was a lot of people want to know that what is the logic behind wearing a mask at home and how can it really prevent the spread of COVID-19?
I think that's a really huge and tall ask to ask, right? When we were kept at home, lockdown, it was difficult to stay at home for so many months. Now to say that even at home, you need to not live like you live in a normal house, I think that's a huge ask to ask from Indians. So I think rather than masking up at home, protect yourself when you go out so that you don't get the virus in is what I would say. Yes, there is a theoretical chance that do not treat everybody you meet as a potential infector of yours. It could be a close friend, it could be anybody else. Sometimes when we look at someone coughing, we move away from that person. However, the people who infect us most are the most asymptomatic of people who are our close friends and we think, oh, let's give this guy a hug or let's shake hands with this guy. then that's the person who's infected you, not the person who's coughing on your face.
Okay, all right. 18 plus can now get a jab. So this is good news for all the youngsters in the younger population of India. But there's a lot of myth around vaccines. So there are reports, in fact, of people getting COVID-19 and getting a positive result after the first jab. And doctor, you have said, I've seen this on your Twitter feed, because you're very active in busting myths as well as a COVID warrior. There's something called that this can be attributed to, that you get a first jab and you test positive to something called the Peltzman effect. Can you please explain exactly what this means?
First and foremost, Shivangi, I would like to say that vaccines are saving lives. Let's dispel any myths that anyone puts forward that, oh, this is someone has got this kind of stroke, this one has got this kind of blood clot. Remember, mass populations, there are going to be a few things that go up and down. But the, the best thing is more bang for buck, vaccinate yourself early. Today, the Indian government has luckily given you the opportunity for 18 and above to register and vaccinate yourself. One proven fact is whichever vaccine you take, the chances of you going to hospital or getting a severe disease comes down drastically if you've taken 2 doses and are at least 1 month out from it. Yeah. So the sooner we vaccinate our population, the earlier we will be to be able to fight this pandemic. The earlier we'll be able to open our economies. You've seen that Israel has opened up. You've seen that even in the US, the president has come out with a statement saying that if you're vaccinated, you don't need to mask up even in public. I mean,
Right.
it's a pipe dream for India yet. We've got a long way to go. But if you're pregnant, if you've got allergic reactions, unless you've got allergic reactions to the polyethylene glycol, which is part of the vaccine, please remember it's very safe for you to take. So dispel all myths that people surround you that you can't take it because you've got this, you can't take it because you've got periods, you can't take it because you're pregnant. Well, large studies in the US have shown that mRNA vaccines, which you were so scared of before, have proven to be equally safe in terms of pregnant women, in terms of lactating women. All this is now scientific data available. So please go and vaccinate yourself right now, if not tomorrow.
Right. Dr. Lakravara, so what exactly is Peltzman effect when someone goes for the first jab and then they test positive? What exactly is that, though?
So I'll tell you where people are testing positive after a vaccine and they blame the vaccine. It's not the vaccine. Actually, a lot of people are rushing into vaccine centers where there's almost no masking, no social distancing, and they pick up the vaccine. There's a theoretical chance that they could be positive even whilst coming for the vaccine jab, which they're not aware of because they might be asymptomatic. So the most important thing is the best thing would be to go test yourself, do an RT-PCR before vaccinating so that you're 100% sure you're not there. Next, after taking the vaccine, please don't let your guard down. Peltzman effect is where people used to say that once you got seat belts on, majority of the accidents happen because people let their guard down. Doesn't mean that you drive recklessly and do not die out of it just because you've got a seat belt on. So today, vaccines are giving you an opportunity of saving yourself from severe disease. It's not preventing you from getting the disease and head on passing the disease on to somebody else. So don't let your guard down, even if you're vaccinated.
Right. Okay. Okay. Fine. That's a great tip. In fact, that just because you're vaccinated does not mean that you do not follow the COVID-19 protocols. Right. That is very important, as you said. Also, lastly, which myths should NewsMobile viewers be aware of? Because a lot of myths floating around, and the entire country, in fact, is slowly getting vaccinated. So, especially for our NewsMobile viewers, could you give some quick tips and bust a few myths which are circulating around?
There is no known cure for COVID-19 yet. Please do not go out and rush out for remdesivir, tocilizumab. They do not save lives. There is enough of data there. It can only decrease your length of hospital stay if given early in the disease at the right time. So please don't go out and stand in huge queues trying to get that one drug, hoping that that will save your patient's life or your loved one's life. It will not. Please go out and take appropriate early medical opinion when you need to. Please go out and vaccinate yourself. Hot water, gargling with hot water, desperately taking drugs that increase your immunity does not save lives or save you from COVID. The only way to stay away from COVID is stay at home unless you desperately need to go out. When you do go out, keep your distance from people. Please do not go in crowded places. whether it's your religious head, whether it's your political leader, whether it's whoever exhorts you to do so, you've got to save yourself first and then save your family. So remember this, you are responsible for yourself. Be jawabdar yourself, and that's the only way you'll be able to save the rest of your family and rest of India.
Right. Thank you so much for joining us here, Dr. Lakrawala, on News Mobile. That was very informative, and I hope our viewers got some great tips from you.
Thank you, Shivangi. Stay safe.